Basal Cell Carcinoma by Siobhan Davis. This is for the Introduction to Human Anatomy and Physiology for Dr. James Cummings, due on October 6, 2021. What is basal cell carcinoma, you ask? This is a type of skin cancer that rises from basal cells in the lower epidermis. This often invades surrounding tissue but seldom metastasizes. To your left hand of the screen, this is one of the actual pictures of what basal cell carcinoma looks like on the skin of an individual. Now that we know what basal cell carcinoma is, we need to know where it is located. These cancers in particular start in the cell layer. On the picture to the right, it shows the exact formation of how basal skin cell layer looks. This usually develops on sun-exposed areas, and these areas can include the face, the head, and the neck. It does come in other areas of the body, but it's most frequently found in the face, the head, and the neck. And these usually tend to grow very slowly. One of the causes for basal cell carcinoma is a mutation in the DNA. The genes that are usually mutated for basal cell carcinoma are the PTCH1 or the PTCH2. These genes are known to be tumor suppressors. They normally help keep cell growth in check, so changes to these genes can allow cells to grow uncontrollably out of control. And when this happens, this will be a result of cancer. When the tumor suppressor gene is mutated, it results in a loss or, a reduction in its function. So once these two genes have been mutated, it allows, the cells to grow uncontrollably. So a main cause of basal cell carcinoma that most people know is the ultraviolet light. You can get this from chronic sun exposure or repeated use of ultraviolet light, which includes UV rays from commercial tanning beds. Yes, I said it, commercial tanning beds. Constant use of a commercial tanning bed can cause basal cell carcinoma because of the UV ray. Some symptoms of basal cell carcinoma usually are a change in the skin that will not heal. These could look like pearly white, skin colored, or pink bump, brown, black, or blue lesion, flat, scaly, or reddish patch, or a white, waxy, scar-like lesion. If you look to the left of your screen, you'll see a few pictures of typical appearances and characteristics of basal cell carcinoma lesions. The top right picture shows the bump that has the small blood vessels on the surface. This one usually will show a shiny, pearly appearance. Underneath of that, you have that rolled border. That's a raised bump. From there, it's still showing that shiny, pearly appearance. Under that is when it gets bad. The central erosion or the ulcer. That's the breakdown of the skin. At this point, that means that you have experienced the two above and it's untreated. This is when it's really getting bad. Okay, so these are just some more symptoms of basal cell carcinoma, but a little bit more in detail pictures. The first picture to the left is showing an open sore that doesn't heal. So it's just basically showing you on real skin a picture of a basic open sore that does not heal. So that's like the gist of the basal cell carcinoma. Now, to your right of that picture, the upper top picture is that shiny bump, that beginning bump that we were talking about. Underneath of that is that reddish patch or irritated area. So that's another symptom that it could look like if it wasn't a bump. It could be that reddish patch or an irritated area. Now, to the left of that, to the right of that, your upper corner, you'll see the scar-like area that has a flat white, yellow, or waxy in color. That's, an example of what, on the previous slide we were showing and we were speaking about that flat white, waxy color. And then underneath of that one is a small pink growth with a slightly raised, rolled edge and a crusted indentation in the center. These are, the symptoms of how they would look on skin of an individual. So one of the forms of treatment for basal cell carcinoma is Xyclara. This is a medication treatment that can include a prescription cream. This is not the only cream or medication treatment for Xyclara. It's just one of the main ones. This can be applied to the actinic keratosis and early basal cell carcinoma. So basically that bump that we were showing, that pink bump that we were showing in the previous slide, this is what that would be for, the early term stages of the basal cell carcinoma. This also, what it does is it causes the immune system to react to the skin lesion and destroy it. So basically once you put the cream on your skin, it basically is going to react to your immune system, and that reacting to your immune system is letting it destroy it, and it's doing that within, which will destroy it without on the outside. The next up treatment that we would do for basal cell carcinoma is the medical procedure. Anytime that you are trying to do any type of surgeries, I would say, for basal cell carcinoma, you have to go through the medical procedure first. And what that is a skin biopsy. It's a procedure to remove cells or skin samples from your body for a laboratory examination. They actually want to make sure that the surgery is best for you and not the cream. The final treatment is the surgery. Now, when you get to the surgery, this is because after the skin biopsy, they refer you to get a surgery. Or because the cream, you went through the cream and it wasn't enough. That could steer you to the surgery, but you're always going to go through the skin biopsy to get to the surgery. Now, the type of surgery that is used for basal cell carcinoma is a Mohs surgery. It has the highest cure rate for basal cell carcinoma, and the entire process only takes several hours. This is, different from, regular cancer surgeries because it only takes a couple of hours. Well, I wouldn't say a couple, I would say several. But this procedure is done in stages and is all in one visit, while the patient waits between each stage. So each stage, out of the 7 stages, every time you go through a phase, you will have a wait time in between. The first stage is the examination and the prep. The second stage is the top layer removal. The third stage is the lab analysis. The stage 4 is a microscopic examination. Stage 5 is that second layer removal. Stage 6 is the wound repair. Now, if you look to the left of the screen, you can see it's like pin marks over top of her lip. There is what there's meaning by the wound repair, because once it's at stage 6, the red lesion that is right there is actually already removed. So at this point, we're just repairing the wound. And then at stage 7, that's when everything is finished up. We're making sure everything is good, and they're going over retracking, making sure everything is okay. Preventing basal cell carcinoma. One of the main prevention is sunscreen. Use some sunscreen. Daily use of SPF 15 or greater can reduce any risk of a skin cancer. Side note though, did you know that most dermatologists recommend you to use sunscreen all year round, not just the summer season, because that sunscreen is a layer that is allowing the UV rays to hit the skin but not transform it into any damaging wavelengths of heat or light. Another prevention is avoid using tanning beds. Yes, that's what I said. Avoid using tanning beds. The prolonged exposure of UV radiation, even without a burn, can lead to long-term DNA damage. If we backtrack a couple of slides when we were talking about that cause, DNA damage was one of them. Avoid using a tanning bed. To wrap up this presentation on basal cell carcinoma, we have some additional information for you. This is one of the most common skin cancers and most frequently occurring form of all cancers. If this is left untreated, it can be changed to be very aggressive and cause disfigurement in some cases. If you remember on a couple of slides back, it was that lesion that was already open and full. That's the disfigurement. It can cause disfigurement in the skin. Once treated, this skin cancer is completely removed. if we backtrack again to one of them stages in the surgery when they're finishing up and they're going over that, it's being completely removed. It's being taken off your skin, just as well as when you're using that cream, it's basically destroying it from the inside to be removed from the outside. So in conclusion, just pay attention to your body, because your body will never lie to you.